Another big one. So those of you, that are gluten sensitive, it's very important that you understand that one of the hallmark reasons why a lot of people that go on a gluten-free diet and they don't get better is they have a gluten mimicry component. They've got yeast overgrowth in their GI tract, right? And so yeast produces something called a hyphal wall protein. And that hyphal wall protein mimics or looks like gluten. It has homology with gluten, and so you get what's called a cross reaction. So you're reacting to a protein that yeast overgrowth is constantly producing, and your body's reacting to it in the same way that it would react if you were eating a sandwich or if you were eating gluten. So yeast can mimic gluten. It's very important to understand that, because if you're following a gluten-free diet but you're still struggling with symptoms, it's very possible you could have a yeast overgrowth. And that could be contributing or leading to that persistence. Now, if we look here, this study published in 2015, humoral immunity links Candida albicans infection and celiac disease. This is what I was talking about a minute ago. The protein HWP1, that stands for hyphal wall protein, expressed on the pathogenic phase of Candida albicans. So this is a protein that Candida produces, presents sequence analogy with the gluten protein gliadin. So it looks like gliadin, it mimics it. And so this is one of the reasons why researchers believe it could be a triggering factor for celiac disease. And so if you look at this diagram down here, if you've got a genetic susceptibility to gluten and you go on antibiotics, those antibiotics create a yeast overgrowth. And then that yeast produces hyphal wall proteins that mimic gluten. And that gluten then damages your small intestinal lining, and then you can develop celiac disease. But you could also develop other problems that, from a non-celiac gluten sensitivity perspective. So, some people don't develop the celiac aspect, so they don't have the autoimmune attack against the GI tract, but they have an autoimmune process that happens elsewhere in the body. And so this same aspect, this yeast, this gluten mimicking protein can create intestinal inflammation, which leads to leaky gut. And so now this protein can leak through, and now you get systemic reactions. And so remember, gluten, what is gluten? It's a neurotoxin. That's one of the ways it affects people. So neuropathy and epileptic seizure disorders have been linked to gluten, and ataxia and vertigo or Meniere's disease has been linked to gluten. Several forms of degenerative neurological disease and joint arthritis have been linked to gluten. So if you've got, again, a yeast overgrowth and it's punching through a leaky gut, you can develop the problems with the non-celiac gluten sensitivity. So again, it doesn't have to just be celiac disease. Important to understand that part. So let's say you have a yeast overgrowth. You suspect you do. Now, I don't want any of you to construe this as medical advice for treatment for yeast. You should always work with your doctor if you suspect you have candidiasis or you have a yeast infection. But what I want to do is teach you about strategy. So when you're taking this information and you're working with your doctor, think about these strategies and how you could implement them as well. So number one is flushing them out. So yeast in the GI tract specifically, you flush them out. So what does this mean? This means don't get constipated. A lot of people with yeast overgrowth are constipated because the yeast can hijack the motility aspect of your GI tract and can shut it down, and so creates constipation or a constipatory effect. And so that yeast is now no longer being pooped out with your poop. It's kind of preventing you from pooping on a regular basis. And so, they're just hanging out and being fed. They found a home. It's warm in there. There's plenty of food. They don't want to go. They don't want to leave. So they want to create that constipation effect. So you flush them out. And so, some people use magnesium to go to the bathroom. You can take extra magnesium. One of my favorite ways for flushing is vitamin C, and I'll elaborate a little bit more in just a minute. But I really like to use vitamin C, especially if somebody's got this problem right here. You use vitamin C to stimulate or to bring water into the bowel, and it helps, it helps the bowels move. It helps them push. And so, in a sense, now you're creating an effect where they can't just stay in you and constipate you and live and eat all your food and grow and thrive. Number two, as far as a strategy, is starving them out. And I spoke about this earlier. is you starve them out by not feeding them. Yeast want carbohydrate, they want sugar. So if you cut those things out of your diet as you're, again, if you're working with a doctor and you're on fluconazole or one of the other, diflucan or one of the other antifungals, you want, if you're taking that medication, you definitely want to change your diet simultaneously so that you're not feeding them at the same time you're trying to poison them, because that's where this comes in. Is those medicines your doctor might prescribe, right? Those are the poisons, and so you want to help that out by not being constipated, by not feeding them. You also want to create competition. A lot of people, why do they get a yeast overgrowth? We said this earlier, antibiotics, right? So what happens is you reduce the microflora. You reduce the healthy bacteria. There are several different species like Lactobacillus, Bifidobacter are two of probably the main ones that can help to create competition for yeast overgrowth. Remember, your gut's like a garden, and think of your healthy bacteria are your plants. And so they're growing, and you want healthy plants to produce your tomatoes or to produce your squash or whatever it is that kind of plant that they are. And think of the yeast and too many of that as like weeds. And if you get too many weeds, your plants won't do well. So create competition by having healthy plants. And so having good, healthy gut microflora, lacto and bifido, you can eat fermented foods. You know, sauerkraut's a good option here. But one of the other things that creates really great competition for yeast is a different type of yeast, one called Saccharomyces boulardii, or S. S. boulardii is a type of yeast. Technically, it creates competition for Candida. There have actually been a number of studies about S. boulardii making it harder for Candida to flourish. So you want to have, you know, a strategy within your diet to make sure you're getting these fermented foods with these things in them. Again, so it's flushing them out, taking care of any constipation that you have, starving them out. Okay, you can. We go to number 3, creating competition. So having, you know, again, how else do we create competition outside of fermented foods? Is don't take the antibiotic. If it's a yeast overgrowth, don't drink chlorinated water. Filter your water and get rid of the things that have antibiotic effects on your GI's microbiome, like the pesticides and other things. So, you know, this way your flora can flourish, and they'll create natural barriers or natural competition for that yeast. And then number 4 is poisoning them out. And this can be done, you know, if you visit with your doctor, a lot of times, again, they'll write you a prescription for an antifungal. There are natural things that you can get in your diet that actually have antifungal properties as well. One of them is caprylic acid. Now, caprylic acid is a type of substance typically derived from coconut. So if you like coconut has a lot of caprylic acid in it from a food base, and so caprylic acid has a lot of antifungal properties. So does thymol. So if you use thyme, like I said earlier, many of you may have a sinus fungal overgrowth, and so essential oil of thyme, breathing some of that in. Again, thyme has a lot of antifungal properties, and so you want to support your body's ability to fight. I was talking about vitamin C earlier, and wanted to point a couple of things out. In this study, you can see here the antimicrobial properties of vitamin C. One of the reasons why I was saying earlier I really like vitamin C over magnesium in this situation, if you're trying to support your body with supplements to overcome, because magnesium is great. Again, it pulls water into the bowel and it works great. Vitamin C does the same thing, but here's why I like vitamin C better if you suspect you have yeast overgrowth. Is that vitamin C has all these wonderful immune properties. And you can see here, vitamin C exhibited low-level fungistatic activities against Candida albicans. Thus, vitamin C possesses potent antimicrobial properties, reducing pathogenicity of bacteria, viruses, parasites, and fungi. So vitamin C has all these wonderful properties already, right? And so if you're taking it to get your bowels to move a little bit better, to pull water into your bowel, you may get some benefit in your immune system because it's supportive of your immune function. But here's something else to consider. This is an interesting study published in 2011 on vitamin C, what they found, ascorbate decreases the mucosal inflammatory response to gluten in an intestinal biopsy culture model. So this test wasn't done in humans, but it was done in a biopsy culture model where they're actually using vitamin C and found that vitamin C reduced the inflammation caused by gluten in this model. And so if you're already trying to be gluten-free, remember yeast mimics gluten, so that protein, there's, if you think about it, if the protein, hyphal wall protein from Candida can mimic gluten, and gluten causes intestinal inflammation, and vitamin C in some research has been shown to help with the inflammation caused by gluten, then theoretically, maybe possibly it could help, it could help support you in this situation as well. So vitamin C, because it can help with inflammation, it can help as it has natural antifungal properties, but also because it can pull water into your bowel and help your bowels move. So all in all, these are things, these are strategies that you should talk with your doctor about to make sure that you implement them, especially if you're going to do any kind of prescriptive medications. You want to make sure you're doing all of your part, because the drugs are not a foolproof. A lot of times the drugs the doctors prescribe, they don't do the trick. They don't get rid of them. There are a lot of resistant fungal species and Candida species that don't react well to the medication. So you want to do everything that you can within your power to help that work. But again, there you have it, 4 natural strategies to overcome yeast overgrowth.